Okay, Ashrita, are we ready to for me to share my screen and introduce everyone? It looks like we've got quite a few people in here, which is always lovely to know. I think we always fear in an online environment that we will have no one come. So we appreciate all of your attendance, especially as some of you I know are probably waking up in the very early morning, or maybe this is very late at night. And I love the fact that this is a global audience. So I'm just going to confirm with my presenters that my screen is showing and it's the correct slide. Anyone get Ashrita, can you give me a thumbs up? You're the only person I can see. Excellent. I'm going to ask that repeatedly because I do have a habit of just talking without my slides on. But I want to say welcome to everyone. This is going to be an absolutely fantastic session today. We will be discussing the differences between mapping, scoping, and evidence and gap maps. This is, I think, a really pertinent topic. I know that scoping reviews are very popular, and there's an emerging popularity coming with mapping and evidence and gap maps. But I think the question lies, what is the difference between them? And so hopefully by the end of this panel, we'll be able to give some clarity to everyone here about what the differences are between mapping, scoping, and evidence and gaps maps. We've got one of the most exciting panels, and I'm so lucky that I get to work with each and every one of these panelists. We are all on the evidence and gap maps, mapping and scoping reviews group as we try to work out the methodology on all three of these reviews. And it's an exciting time for all of us, and there's been so much discussion, and I've definitely learnt a lot. So firstly, we have I'm actually going to go in order. I'm going to say we have Dr. Fiona Campbell. She's going to provide a broad overview from forming the question between these review types, and she's from Newcastle University. We have then Dr. Ashrita Saran, and she is going to be talking about evidence and gap maps and providing some fantastic examples. We will then have Associate Professor Hanan Khalil, and she'll be talking specifically about what scoping reviews are, an overview of them, and giving some case studies on how to do a scoping review. And then, unfortunately, Andrea Tricco could not be here today, so I am here, and I get to talk about the extraction, analysis, and the presentation of scoping reviews, which is actually a new paper that's come out from our JBI scoping review methodology a month ago. So it's going to be an exciting time. Please put in the chat any questions that you may have. Sorry, not in the chat. Realized we didn't have one. In the live Q&A, please put your questions in there. We are going to have a Q&A panel after our short presentations, and hopefully we can really have a good discussion with you all. So firstly, I will introduce Dr. Fiona Campbell. Would you like to come on screen, Fiona, and talk about, to give a broad overview?
Yeah, thank you. Just sharing my slides.
Excellent.
Okay, thank you. What a privilege to be here at this Global Summit, and also to be presenting this panel alongside my colleagues. As Danielle's described, we've come together because of a shared interest in these big picture review, family type reviews. And it's been a real pleasure to explore some of the issues with them during the past year. And I'm going to be describing some of our thinking and how that's evolved. And I'm also going to be illustrating by talking about an example of a mapping review that I was involved with colleagues at Sheffield University. I ought just to acknowledge that my funding is from NIHR and Newcastle University, but the views that I'll be expressing are those are my own and are those of the Navigator group here today.
Fiona, do you mind just putting your slides onto the onto a big version, onto the slide versions? I can just personally see your PowerPoint.
Danielle, as presenters, I don't think so we would be able to see that, but I'm sure the participants can see the full version of it. Yeah.
Oh, I do apologize. That's my fault.
Okay. Should I just go back? Sorry, I'll just go back to sharing again. Is that okay?
Yep.
Okay. So I think one of the things that we spent quite a lot of time exploring as a group was why were there some confusions over terminology? Increasingly, I was finding, and have done over the last few years, that as commissioners come to us and ask for reviews to be undertaken, that the type of approach that we should take in addressing the questions that they're asking were not always going to be effectiveness reviews. And increasingly, I've been undertaking one of these big picture review types. And as I started to try and look at the literature, I felt that there was some confusion, that sometimes terms were used interchangeably. And those were some of the things that we wrestled with in our methods group. This is just an infographic. I know the writing's small. I'm going to delve into it in more depth in the next few slides. But this was something that we pulled together to try and think through what are the features that are the same across these different types of reviews, and what are the characteristics of these types of reviews that are different. So what is similar? What do these all share? Well, fundamentally, they're asking a different type of question. They're asking a broad, big picture research question, something like what types of evidence are available in a given field, or how are concepts or definitions used within the literature? How and where is research conducted on a certain topic? Quite different to the types of effectiveness questions we will ask if we're addressing in a systematic review of effectiveness. But nevertheless, the approaches that we used are...
Sorry, Fiona. Sorry, your slides are not moving, Fiona. I'm sorry.
At all?
No, at all.
Fiona, I think you've just accidentally shared the wrong screen. What we are seeing is your PowerPoint screen. So are you able to share your screen again, and maybe you just need to switch it over?
I'm not really sure what's happening.
That's okay.
I wonder, Ashrita, if you can share my slide sorry.
Danielle, can you please try resharing it and just put it on the big screen and try moving, and let's see what happens there.
I've lost. Okay.
I think everyone's just so excited to read all the work you've been doing, Fiona. Everyone's from the chat's loving it. We knew there would be technical difficulties.
Okay, let me pull out the slides in case.
I'm happy to share them, Fiona. I've got them up.
Okay.
Would you like?
These were the ones that are in the shared drive that I put onto the shared drive.
I can see your slides, Fiona, now. Could you try clicking the big screen icon at the end, and I'm sure it should be visible to everyone.
It's in the bottom right corner.
Yeah.
I'm sorry, I haven't got that.
Could you try moving your slides now? We can just quickly have.
Sorry, if I do that, is it any better?
Yes, we can see it now.
Yes.
That's
okay. Is that any good? Okay. So are you with me now? This
yes.
is the, okay. Right. Let me move on to this one. Okay. So these are the features of that we say are that we feel are common across all of these types of reviews. I mentioned the fact that they're asking big picture review questions, but they all will adopt systematic and transparent methods which ensure their rigor. And also there will be protocol development as in systematic reviews. And I think that, they may include a variety of different types of evidence. And they may also may or may not include quality appraisal. And of course, this will make them very distinctly different to a systematic review of effectiveness. The synthesis approach is very different, and I think Danielle will be touching on these. That they may that the type of summary will be descriptive. There may be numerical summaries, but it isn't like a synthesis, and those will often be presented graphically. And this is just to illustrate where we felt, and these are more trends. There isn't necessarily a clear distinction between them, but these were perhaps patterns we felt that were emerging in these different types of reviews. So scoping reviews, which may be inductive or deductive, whereas mapping much more deductive. So for example, in a scoping review, you might ask, how is a concept been used in the literature? In a mapping review, you might ask, what are the terms that have been used in the literature? In a scoping review, there might be much more in-depth data extraction, whereas in a mapping and an evidence gap map, much more higher level data extraction. And that fits with a scoping review, which may have, although they're addressing broad questions, maybe a much narrower focus, whereas in a mapping or an evidence gap map, we'd anticipate that the focus would be much broader. And also the quantity of included literature tends to vary too. Within scoping reviews, perhaps 40 to 80 studies. Within a mapping and evidence gap map, a much larger number of studies. A scoping review may include some kind of iterative processes and qualitative analysis, whereas in a mapping review, you wouldn't see that in the same way. And I'm just going to illustrate it with a mapping review that I was involved with colleagues at Sheffield University. And this was a review looking at the role of the epilepsy nurse specialist. And this was a review that was commissioned by Epilepsy Action. And they wanted us to look at how many roles, what were the types and the nature of the roles of the epilepsy specialist nurses, and what sort of evidence was there available to support those and had been used to evaluate those different roles. So as you know, the type of review methodology we use is going to be informed by the type of question that we're asking. So the questions that we were asking for this review were, what evidence has been proposed, described and evaluated? What are the roles that we're seeing described? What is the overall quality of that evidence base? What was the type of study designs that have been used? And what were the research gaps? And this was because our commissioners wanted to use this information to be able to support commissioning bids for these specialist nurses, and also to identify research gaps. And just a shout out for this really handy online tool, Right Review, which when you're exploring what type of review approach to use, and it can be incredibly confusing because there's so many, this takes you through a series of questions that can really help guide you. Anyway, we felt for this particular review, for the types of questions that we were asking, the most appropriate approach was a mapping review. We included a wide range of types of evidence. We wanted to see what are the different ways this role is described. So we used everything from RCTs through to opinion pieces so that we could capture all of the different ways that might be described, recognizing there might be some of those roles that are described but have never been evaluated formally. We also worked very closely with a stakeholder group, which included nurses themselves, patients, commissioners, and specialists. And we created a framework, and it was driven by the different roles that this group identified. And we got them to work quite hard to really articulate the many different roles that that these particular specialist nurses fulfill for patients with epilepsy. And I mentioned that mapping reviews often have graphical presentations, and what we created in this particular mapping review was an evidence gap map. Now, this was before EpiReviewer and EpiMapper were available, so we worked with a group of computer students at the university in order to be able to create something that was visually appealing and also accessible. And this allowed our commissioners to be able to see very quickly where the evidence was for and what the type of evidence there was for these different roles. And it was able to enable them to identify where there needs to be more research, but also identify which parts of the role have got better support, and was able to illustrate that there are some key areas of their roles where there's very little evaluation, nevertheless they're highly valued by patients. I've just mentioned the Espente study and also that work that we've been doing, looking at the similarities and differences. And so if those are both pieces of work that are sort of in the publication pipeline, if you'd like copies of those, please do drop me an email and I can forward them on to you as soon as they're ready. And also a link to that Right Review web-based tool to help guide the decision about the appropriate review methodology. Thank you very much.
Thank you so much, Fiona, and that was a fantastic overview of the differences. And I know that this has been a discussion between all of us in the group, and I loved how we've all come together and really have worked out the differences and teased it apart. So thank you so much for that. I really appreciate it. We're going to move on to, and I'm going to emphasize, you'll be able to ask any question you want to Fiona at the end of all of our presentations, and we'll come together as a panel to have discussions. I don't know if you can see, Fiona, but you've got a lot of applause floating up on the screen. I just noticed.
Is that sympathy for the PowerPoint problems?
We're okay. I think everyone was just enjoying listening to you. We don't need PowerPoints. So I'm going to move to Dr. Ashrita Saran. She is going to be presenting on evidence and gap maps. So Dr. Ashrita, would you like to be able to share your screen now?
Great. I hope it's visible.
It is. Yeah, perfect. Excellent.
Great. Thank you so much, Danielle, and good afternoon and good evening, everyone. I will be talking about one of the members of the big picture family, which is evidence and gap maps. And we'll also talk about some of the innovations that we have done in evidence mappings. So evidence and gap maps, they're basically systematic presentation of the available and the most relevant evidence on a particular sector or a subsector. It could be ranging from homelessness to transport or to child well-being. Important thing about evidence and gap map, like the members with any other family of the big picture, that is mapping reviews or scoping reviews, they're broad in its scope. And typically a maps will usually have a systematic review and will include an impact evaluations. But it is possible that it may include only one of these and sometimes may also include other evidence and gap maps. And then they're typically referred to as map of maps. An example of which would be a map of maps on international development, which was published by 3IE. And when typically evidence and gap maps include systematic reviews, they are referred to as mega map. An example that you can see on the right-hand side of the screen, which is a snapshot from mega map on child well-being. Now, important distinctive feature between the scoping reviews, mapping reviews, and other broad picture family members would be that evidence and gap map, they are highly dependent on the framework, and framework is, or the primary dimension is essential part of creating an evidence and gap map. The main purpose is to maintain the comprehensiveness of interventions and outcomes that are, developed and created for a particular sector, and hence reliance on framework helps us maintain the comprehensiveness of interventions and outcomes. Now, there are two different ways in which we get to the framework. One is, of course, if there's a widely accepted international typology of interventions and outcome that is available. And for example, for people with disability evidence and gap map, we relied on the World Health Organization community-based rehabilitation matrix of outcomes, and we developed and adapted and use that framework to define the interventions and outcomes. Sometimes you might also need to modify your international existing structures. For example, for violence against children evidence and gap map, we modified the categories, which was based on the inspire category. For example, there is no suitable framework available on that particular sector or your research topic. That in that case, also comprehensiveness has to be ensured either by consulting strategy documents or project documents of leading international actors and agencies that fund the MAPA research, or by doing wider stakeholder consultations. Two things I would want to highlight here, that like with any systematic reviews, the entire process of evidence and gap map generation is extremely systematic and transparent. And one important distinction again, that evidence and gap map will only tell us how much evidence is out there and not what evidence says. There's obviously exceptions. There have been evidence and gap map that have done that kind of analysis, but typically it does not tell us what evidence says. Now, when I mentioned that primary dimension of the map is essential because it helps us visualize the evidence and gap map altogether. So the second distinctive feature in an evidence and gap map is the visualization and the way it is presented. Typically, the visualization will be interactive version of the map and will also present the map in the framework of interventions and outcome, as you can see here. The bubbles in the picture that you can see here, they tell you about the kind of evidence that is there, and it will also give you an idea about the confidence in the study findings. So typically, in an evidence and gap map for systematic review, it is recommended to do a critical appraisal to identify the confidence in the study findings. It is also recommended to go ahead and do the critical appraisal for impact evaluation to be able to provide a better idea about the implication of those research that we have done for evidence and gap map. The most common way of presenting is the interventions and outcome, but there are different ways of presenting the map in terms of visualization, such as interventions and population and intervention and region. For example, if we want to see the concentration of evidence across region and across intervention, that kind of visualization is also possible with evidence and gap map using Epi-Reviewer. Also, I mentioned that evidence and gap map, they're extremely interactive. So if you can hover over a cell and see the number of studies, if you click on the numbers, you can also go back and see the number of records to it. You can go and read the user summaries that have been created by the authors of the evidence and gap map, and also find link to the source of the study altogether. Apart from the primary dimensions, evidence and gap map, they also have secondary dimension of filters to explore the map with a particular focus. For example, if I'm interested in looking at evidence only from India, you can do that in the online interactive version by clicking on that cell and filtering it out using the particular focus. Now, that was about the two distinctive features. What is also important to understand what evidence and gap maps tell us. What you see here is an evidence architecture or evidence pyramid. The top three level tell us these are basically your decision-making products. But to get to the top of the level, you have to have a stronger base. And evidence and gap map, they actually are the link between the top of the pyramid and the bottom of the pyramids. So what is interesting to note here is that evidence and gap map are not usually an end to themselves, but a step towards further work altogether. I'll give you an example from an evidence for disability in development in which the funders and the researchers, they actually worked on a series of evidence product building onto the existing product. So in 2017, a SEDL-funded map of maps on international development that included only evidence and gap map across the international development sector. In consultation with the FCDO staff, there were three priority areas that were identified. That was transport, people with disabilities, and access to justice. Now, again, in consultation with the FCDO staff, the people with disabilities were the priority area at that point of time. So in consultation and doing a lot of stakeholder exercises, important priority areas were identified on which 4 rapid reviews were conducted. And the areas were education, livelihood, social inclusion, and empowerment. These reviews were again now being conducted into full systematic reviews. Livelihood is already published, social inclusion under peer review, and education and empowerment, they're currently under construction. In the meantime, ICD was funded by SEDL to work on a disability evidence portal, which will use the evidence from PANDA-supported systematic reviews to get into the evidence portals. Currently, a prototype of this disability evidence portal is out that includes 8 evidence summaries altogether. So the summary of this is that, using the existing products, how we can build on the, new existing and evidence synthesis products is something that is possible with evidence and gap map, because it helps us identify where are the key gaps in terms, and also help us identify the research priorities. There are also some innovations in mapping that have been done in the past years in terms of content. For example, map of maps and mega maps, because they have really broad scope and includes systematic reviews, impact evaluations, as well as other evidence and gap maps. There have been innovations in terms of mapping the methods. For example, Imana has done an evidence and gap map on agricultural and nutrition methods metrics. Of course, effectiveness maps, they are most common, and there have been several effectiveness maps that have been published in the past years at Campbell collaboration. There's an innovation in terms of including process evaluation alone. This has been done for homelessness, and there has been an innovation in terms of including both impact evaluation and process evaluation. This has been used in a number of evidence and gap, for example, youth crime. And of course, country evaluation maps have been quite evident now. It started with Uganda, and now we have developed, country evaluation for other countries as well. There can be innovations in the mapping process itself. For example, use of machine learning has been increasingly used in the system, in the mapping process altogether, for screening, for prioritizing the screening. Because when you talk about a sector of evidence and gap map, you definitely understand the number of studies that will come out from the search can be somewhere between 19,000 to 20,000. So priority screening and use of machine learning has made that process a lot easier. And of course, searching. So we have also done a lot of searching through OpenLX platform that is inbuilt at Epi Reviewer, that has also helped complement the manual searches. Co-production has also been used, where the commissioners has been involved in terms of piloting, decoding, and doing the extraction. This has been used in youth crime and delinquent behavior and evidence and gap map. Crowdsourcing is something that have also been used quite evidently, specifically in the homelessness sector, where a number of updates has happened over the past years, where the Cochrane count has been used for the prioritized screening and other processes. So you can see that innovations cannot happen just in terms of the type of research that you do, but also in the processes to make your mapping and the entire exercise a little bit faster. If you want to know more about Campbell EGMs, we have a guidance, and we also have a comparison paper that will give you how many organization has done the evidence mapping in the past years. This is, of course, a little dated, but definitely you will find some examples of the organizations altogether. So with that, I would like to thank you, and I look forward to your questions towards the end of the session. Danielle, over to you.
Thank you so much, Ashrita. I really appreciate it. And Ashrita has been really kind and patient with me as she's explained evidence and gap maps to me probably several times during our meetings. And I just want to thank her for that. And I'm sure everyone else really appreciated your presentation. So as I said, we'll be able to have questions after. I see that they're slowly starting to build up. But keep asking away because I'm sure we can have a fantastic discussion between us all. So now I'm going to move on to Associate Professor Hanan Khalil. Hanan is a member of both the JBI Scope and Review Methodology Group, so is Ashrita, and also part of the Evidence and Gap Map and Scope and Review group that we are developing this guidance with. So Hanan will be discussing about what scoping reviews are, an overview of them, and providing some examples of best practice scoping reviews. So Hanan, will you be able to share your screen now, please?
Yeah, sure. Yep, could you? Yep,
Perfect.
Can you see? Excellent. All right.
Yeah.
Thanks very much, Danielle, and thanks to Fiona and Ashrita. Very excellent presentation. So to continue with the theme, I'll be talking about scoping reviews. So I've been involved with scoping reviews, I think now since 2013-14, and working with JBI on a methodology for scoping reviews, and we've published several papers. So basically, scoping reviews, they tend to be exploratory in nature, and they're really about mapping the literature available on a topic, and they could be also used to identify key concepts, theories, definitions, sources of evidence, and also identify gaps in research. Now, you may have come across scoping reviews being called scoping studies or systematic scoping reviews. But we like to use the term scoping review. Also, other terms like literature mapping or mapping reviews and scoping projects have been listed, and they've all only been referred to scoping reviews. We like the term scoping reviews because they actually differentiate between mapping reviews and other types of systematic reviews. Now, the benefits of doing a scoping review is basically because scoping reviews tend to scope or map a lot of literature about, what sort of evidence is out there about a particular topic. They can be very good as precursors to systematic reviews. They're also very useful when it comes to identifying what types of available evidence is there, identify and analyze knowledge gaps, clarify concepts or definitions. For example, you can find scoping reviews maybe defining concepts like stigma, mental health, and other definitions that people are not agreeing on. Examine how research is conducted in a certain topic, and also identify key characteristics or factors related to a concept. And our group has published a paper about the benefits of doing scoping reviews and the difference between systematic reviews and scoping reviews, also if you want to refer to. Now, continuing with the benefits of scoping reviews. Now, scoping reviews are very useful in developing policy maps. So mapping policy documents and research studies have been previously used by other authors. Both authors have used scoping review methodology to examine research papers on policy documents. The value of scoping reviews to evidence practice lies in the fact that it's able to include many types of literature reviews and not limited to research studies. For example, it can include a lot of grey literature, government reports, policy papers, guidelines. So we're not really restricted to primary studies. In general, systematic reviews have more focused research questions than scoping reviews, which are more broader. And as I mentioned before, scoping reviews are exploratory in nature, whereas systematic reviews, thus particularly with meta-analysis, they tend to be explanatory in nature as well. There are three different methodologies of scoping reviews that have been published. So obviously, scoping reviews methods have been proposed earlier on in 2005 by Askey and O'Malley, and that was followed by a little bit more update of the methodology by Levac et al. In 2010. And we've built on these two methodologies, and we've published our first Trobe methods of scoping reviews in 2015, and since then we've been having updates every 2 or 3 years, and our latest update have been updates of the methodology was published in 2021. There is also guidance, Prisma scoping review guidance published in 2018 about reporting guidelines and how to best report scoping reviews in general. These are the three different papers that I've mentioned about the frameworks above about scoping reviews methodologies. Just very briefly, when it comes to scoping review steps and how different they are to systematic reviews, obviously they all have protocol development, they all search for relevant studies. As I mentioned before, the studies are different to systematic reviews. They all go through study selection, charting of evidence. Scoping reviews, we don't have any risk of bias appraisal. We don't recommend them because of the number of studies that are involved in that. However, I know I've came across a few scoping reviews with risk of bias appraisal included in them. And there's also data synthesis. Now, we don't normally recommend implications for policy or practice because of the fact that we don't have any risk of bias appraisal in the process. So scoping reviews are really good to identify research gaps rather than informing practice or recommendations. However, if you decide to include risk of bias in there, then obviously they work like systematic reviews and you can use them for that. But we generally don't recommend that step. So that's just a very brief table about the differences between traditional literature reviews, scoping reviews, and systematic reviews. So the main thing with scoping reviews is that they can't be listed in Prospero. However, we recommend in our methodology that all our protocols be listed either on Figshare or Open Science Framework and with a full protocol methodology. They all have obviously a priori protocol. They've got a transparent peer-reviewed search strategy, a standardized data extraction form, appraisal form, not really, and synthesis. Yes, we do have a presentation of the results at the end. So these are the two platforms that I've mentioned before about registration of the protocol, Open Science Framework or Figshare. When we list or do scoping reviews, we tend to use the PCC mnemonic, so which include the type of participants, the concepts that we are trying to examine or identify, and the context or sometimes the setting. And I'll give you a few examples of some of the reviews that we've published following this. So as you can see, with the concept, so the concept should be articulated to guide the scope and of the research question, and this may include details that pertain to elements that would be detailed in a systematic view, such as interventions, phenomena of interest, or outcomes. So these all go under the concept, and the context, it's usually things like primary care or health services, hospitals, and or regional differences or countries. Now, two examples of scoping reviews that we've published. So one of them was about what are the most common adverse drug reactions experienced in primary care and the drug classes associated with them. So that's a scoping review that we've that I've been involved in publishing, and that one included quantitative evidence and data, and also it included, it's clear from this question that it's only certain types of quantitative evidence and data would be relevant for this review, and that the review will be very specific in terms of population intervention comparator kind of outcome. So for this one, basically the setting for us, or the context, was primary care. The population was anybody who was had a medication, and then the concept was the really adverse drug reactions that we were interested in. Again, another example of a scoping review was the medication safety program. So the characteristics of these programs in primary care. Again, as you can tell, that's a very broad question, and it wouldn't really lend itself to effectiveness review or even qualitative review. It's really about mapping the evidence around medication safety program, their characteristics, who's involved with them, and we've categorized them in our paper based on you know, how many interventions they involved, and also who was the lead, whether it was healthcare professionals or whether it was organizational interventions or structural interventions. And I just want to finish off with this slide just to make sure that we're leaving plenty of time for discussion. I just want to say that scoping reviews are very different to mixed methods reviews. Mixed methods reviews tend to include both quant and qual studies with very distinct research questions to answer. So based on the synthesis of the evidence, whether it's qualitative or quantitative, whereas the scoping reviews, they're a little bit broader, they're very general. So even though sometimes we do include quant, qual, and systematic reviews in there, but they're certainly very different to mixed methods. And I'll leave it there. I've got a few slides and I'm happy to share them with anybody who's interested, but I'll leave it there so that we can also get to answer some of your questions. And also Danielle is going to talk a little bit more about the data extraction for this. Thank you.
Thank you so much. This time certainly does fly, doesn't it, Hanan? In these situations. Okay, I'm going to try to share my screen and hopefully I can do it well. Okay, so do just want to confirm that everyone can see my slides.
Yep.
So thank you so much there. Okay, so I'm going to briefly talk about how to extract, analyze, and present data, and I'm going to focus on scoping reviews because that's, I suppose, where my expertise is. This is this section. When we're looking at scoping reviews, we have a whole plan on how to do one, and I'm focusing specifically on this green section now, which is the extracting, analysis, and the presentation of the results. So this is based on a paper that was recently released. If you QR code, put your phone up to the screen, you will be able to QR code, and this will then be able to take you to the article. If not, it can be found on JBI Evidence Synthesis. I do apologize. I'm going to go really quickly, so you may miss the QR code for that. So why did we actually make this extraction and this guidance? And the simple fact is that we know that it can be challenging for scoping review authors in this stage. There wasn't clear guidance previously, and I think it has led, unfortunately, to a lot of inconsistencies and potentially a lot of inappropriateness in the analytical approaches that are being undertaken within a scoping review. So it's important to remember what scoping reviews are aiming to do. We are not answering questions on feasibility, appropriateness, meaningfulness, or effectiveness. That is for a systematic review where you can do analytical approaches of meta-analysis and qualitative synthesis. Those approaches require things like critical appraisal or risk of bias, because then that makes decisions about clinical practice and the care that patients will receive. That is not the scope of a scoping review. So we're basically doing more, what are the concepts? What are the outcomes? More methodological questions, broader overarching questions that may or probably or shouldn't be implemented directly into practice. So we don't do critical appraisal. So a lot of our analysis isn't doing what is the relationship between A and B. What we are aiming to do more is, here is the descriptives. How many outcomes out there? What are those outcomes? We may categorize, and we may even do a bit more qualitative content analysis, which is very basic low level of qualitative synthesis there. So we must be aware that when we are doing a scoping review, how we will actually do the synthesis of it. And I'm going to talk about some key principles of each stage, but I really wanted to emphasize this. I'm currently doing quite a lot of scoping reviews and large-scale scoping reviews, and I thought I piloted enough. But it isn't until you're actually in the process of doing a scoping review, and I suppose with every evidence synthesis, that you probably recognize that you didn't pilot enough. And you may think you did, but you probably haven't. So do not underestimate the need for piloting at the extraction stage. Don't underestimate the need for piloting at any stage of an evidence synthesis. But I want to emphasize this because nothing worse than having to go back and re-extract through over 300 articles. I'm sure some of us have all been there. So just want to emphasize that. So this comes here. I just really wanted to add this here. Critical appraisal. Do we do it in scoping reviews? No. Some people like to get in the grey zone there, but it is no. And that is, again, because we're not seeking best available evidence that answer a question that's related to policy and practice. And if you're constantly going, what is my review going to do? I want it to change practice. I want to put it into a guideline. I wanted to make policy decision-making at a practice level. Rethink your review type. because again, what we're saying with here is that we are looking at concepts, characteristics, theory, for example. So therefore, a formal methodological assessment of quality isn't needed. And also, when you're doing a scoping review, you're most likely going to be including several different types of evidence sources as well. So that can just be problematic. And what is that really going to give you answers to? So just some principles when you are extracting the data after you think about critical appraisal and the fact that you now don't need to do it, that does not mean scoping reviews are easier, is how to extract. And this is after piloting and extensive piloting. So you need to make sure that you're extracting to all the available answers for your question. So all questions, have you actually extracted there? You will be able to get the answer to that question. You should have multiple reviewers that extract data to minimize bias, but also it's good to have a team approach, because when you've got one person extracting, sometimes you can't have that second person to go, is this the right? Is this right? Am I missing something? Is there another way we could thinking about this? Do we need to change the extraction form? Evidence synthesis is a team approach, and scoping reviews, when they are large scale, need to have that team. So I highly recommend that when you do extraction, that this is not a sole job for one person. This is a team-based approach. And that's why when we have extraction tools and forms, they need to be adapted potentially as well during the process. It can be an iterative process in this extraction stage, but they also might change depending on the extraction, the evidence synthesis type as well. So this is just a bit of an example of how we would present an extraction sheet. And the next question we always get, and this is where we get some problems, is where do I extract from? And remembering we're having multiple evidence sources. So if we're looking at a traditional peer-reviewed article that's quantitative in nature, we're probably going to extract maybe the abstract, the discussion, the methodology section. We might even do the discussion section, might even be the supplementary materials. What it most likely won't be, though, is actually the results section. And what we mean by the results section is we will not be extracting the correlations or the significance, for example, or the confidence intervals. Because again, if you want to only are able to answer your questions with that extracted information, maybe you need to consider a systematic review instead. Don't worry, in the paper, we write this extensively about when there's approaches, when and where you cannot do it. So what type of data analysis do we actually do? We stick to frequency counts, descriptive statistics, and then we can also, maybe when we're looking at the characteristics of a particular issue, or what are the barriers and the facilitators, we can move to a very basic qualitative content analysis. Now, in this paper that I presented at the start, we have proposed a framework on how to actually do that without interpreting the data, because again, that passes the scope of scoping review. And I understand it can be a fine line, but we've got an approach of either an inductive or a deductive approach here. So when we're looking at the inductive, you're not working towards a predefined framework like you will in a mapping review. We're looking for a bit more open coding. For example, you are developing the framework. Whilst if you're doing more deductive, you might already have a framework, and what you're extracting is yes, no, maybe, if there's and maybe examples to show your responses there. So there's different approaches based on the different questions that you have. So how can I present my data? Well, scoping reviews, and I think any really evidence synthesis, can be death by table. So avoid that, please. Remember who your audience is, remember the dissemination tactics, and go, how can I present this in a visually appealing way? How can I tell my message easily without people having to search the tables. So you can be as inventive as you can be. I am certainly not someone that can do a lot of visual stuff, but I was able to get this stuff done in Power BI. There's a lot more creative people in data visualization, but be creative and just remember that this is a form of dissemination that can be used within your work. So I just want to do a bit of a plug for the JBI Scope and Review Network. Again, feel free to QR code that, and that will take you to our network page, which has all the resources that Hanan and I have talked about, specifically to scoping reviews. And we will be able to try to build up the evidence gap maps and mapping reviews soon, hopefully shortly. So I realize I talked really fast then, but I really would love now everyone to get on screen, all of our wonderful presenters, because we have 9 minutes left. So Ginny, quickly, that was Power BI, Microsoft Power BI. We've got a few questions here. I can just see which one we can do here. So, are evidence and gap maps a way of visually displaying the results of a scoping review? I feel like this is a question we really tried to talk about in our group, didn't we?
Yeah, definitely.
Yeah. Okay, so I'm going to pass it over to you, Ashrita, first. Do you think evidence and gap maps can be used as a visual way for scoping reviews?
Okay, so they can be used, but if making a statement that they are just a way of visually representing scoping reviews would not be correct, because we have to be mindful of certain distinction and the certain guidelines that are different for scoping reviews and evidence and gap maps, and of course the purpose and use of both of it. So one thing I would like to highlight here, that evidence and gap maps, they are guided very strongly, specifically Campbell evidence and gap map, by Messier with conduct and reporting standards. And few things which are mandatory here might not be mandatory for a scoping review, and that does differentiate between the two. One is that evidence and gap map have to be guided by a framework, and the reason is, when you say the word evidence and gap map, it's definitely broader in scope. What we're also trying to understand here is to maintain the comprehensiveness of the review altogether, the evidence and gap maps. And we're also trying to understand, get some policy implications out of it. And that is where the mandatory checklist for evidence and gap map is that you have to critically appraise your systematic review. So that is one distinction. That is a mandatory thing. The second thing is, since this is guided by framework, your data collection form has to be pre-registered and pre-approved by peer review feedback. And once that is done, only then you can move ahead. The third important distinction is that the search comprehensiveness. So it is mandatory as per the conduct guidelines of Campbell that you have to complete your searches in all the grey literature databases, including the academic databases. Again, maintaining the comprehensiveness of that. There is no possibility of restricting your searches altogether. And of course, the last thing is the visualization. Visualization is definitely good, and there's number of ways of visualization in any research. It could be tabular, it could be through maps, it could be through anything. But what is different with EGMs is that it is also an interactive version where it links you back to the user summaries. So user summaries are something that is a part of the evidence where you create the user summaries, and that helps you go back to the research. And sometimes if that research is paid, you can actually read the user summaries. I'm going to stop here because I don't want to take other panelists' time here, but I hope that answers the question, because I can talk a lot about it.
As I said, like, this is the problem when we all come together, though. We can talk for more than the hour that we allocate ourselves. So, no, I think you've explained that extremely well. Does anyone have anything else to add to what Ashrita said? No? Okay. So,
sorry, can I just add something? And maybe Ashrita can help me to maybe comment on this as well. But what I've noticed that evidence gap maps can be standalone evidence type of evidence synthesis. They don't have to be associated with a mapping review or a scoping review. Whereas with a scoping review, we always, it's a little bit different. The presentations really are part of the actual review, whereas evidence gap maps can be just a standalone evidence synthesis product.
Yes, I totally agree with you, Hanan, and that's thanks for mentioning that. Definitely, so EGMs, they are not have to be guided by some things. It's not to have to be guided by mapping reviews or scoping reviews. They are a standalone product, and through that, several evidence products can be developed, of course.
Yeah. Okay, so I just want to get to our next question. I think we did compare a lot between mapping and evidence gap mapping, but can we just quickly, in 1 minute, describe the difference between mapping and scoping reviews, just a little bit more clarity. Fiona, you had that wonderful table up. Can you just give us some key differences between the two again?
Yeah. Hi, Ginny. Thanks for your question. We spent ages grappling with this in our group, and we've tried to describe this in the paper, and I'm happy to share that with you, Ginny. It's in press at the moment. And I think essentially these terms are often used interchangeably. What we've tried to do is to give some guidance about broad differences between the two. Scoping reviews tend to have a perhaps more focused approach to a bigger question. They might involve more in-depth data extraction. They usually have a slightly smaller number of studies, so between 40 and 80. They can have some qualitative approaches to them. They can ask more exploratory questions, whereas mapping reviews and evidence gap maps tend to be much higher level in terms of data extraction, much more categorical type approach, often a lot more than 80 studies as well.
Excellent. Thank you so much. Does anyone else, Hanan or Ashrita, would you like to add to that?
No.
I think Fiona summarized them really well.
I think she did. She's brilliant. I think because we worked on, Fiona has led a paper describing the differences between each one of these approaches, which it's under review, isn't it, Fiona?
Yeah.
So it's currently under review. So hopefully we'll be able to release that soon with fantastically glowing peer review and no changes, because that would be brilliant. We've got a question.
Sorry, Danielle. Can I just mention we've also published a paper as well, beginning of the year, with Andrea about differentiating between mapping reviews and scoping reviews. It was published in May of this year, if you want to have a look at it as well.
Excellent. We are getting a question about small scoping reviews, Hanan, which is something that I can't remember ever having. But someone said that the scoping reviews of, say, under 10 reviews, are they worthwhile? Or should we maybe be leaving those sorts of questions, because what is the actual, I suppose, need for a scoping review with a small scoping review?
Yeah, I'll be interested to know a little bit more about the question. I mean, most of the scoping reviews that I've published so far, and the ones that involved in, they really have minimum of about 30 to 40 studies, exactly like what Fiona mentioned. I guess with 10 studies, you need to think about maybe using the tool that you mentioned, Danielle, or one of us mentioned about the right review tool, the one that Andrea put together. And I think maybe by looking at the question carefully and seeing what best can answer, what type of knowledge synthesis or systematic reviews can answer this. But I haven't come across a scoping review with less than 10 studies, even with peer reviewing.
Yeah, I do agree. And this kind of gives the question here that we discussed. If you have a large scoping review of evidence sources, so maybe over 500 included evidence sources or 1,000 included evidence sources, should it just be a mapping review? Or should it be an evidence and gap map? I'm going to get Hanan to do 30 seconds on this, and then I'm going to pass it to Fiona and Ashrita. What are your thoughts? Should a large scoping review just be a mapping or an evidence gap map?
Thanks, Danielle. From experience, I did publish a mapping review on palliative care research in Australia, and it did include about 1,200 citations. And all what I could extract for that many studies, it was really high-level data. And I did wonder about, after publishing it, whether it was really worth doing a scoping review or a mapping review. But thinking back about it, I think it should have been really a mapping review, because the depth of data that I was extracting was nowhere near what I wanted. It had to be high-level helpful because there was many studies. But over to
Okay.
Fiona, if you like.
Yeah,
Yeah,
Fiona, you have 10 seconds.
I would say that we're trying to create a distinction. I think if you look at the examples already out there, you won't see those clear distinctions. This is something that's sort of evolving as these terms are evolving and our experience of doing these types of work. But yes, I would agree that would seem more like a mapping review.
Yeah, and Ashrita?
Yeah, I definitely would see it as an evidence and gap map as well, because of the way of visualization. It would be easier to understand the reporting and what is being reported in those studies. So.
Excellent. Thank you. We got 6 seconds to go. We really appreciate everyone being involved and so engaged. And thank you so much to my fellow panelists, Fiona, Hanan, and Ashrita. Much appreciated. Thank you.
Thank you.
Thank you
so much.
Thank you.
Excellent.